Thank you so much, Dr. Hida, Dr. Khaled. We're going to talk about mental health, right? What Johnson & Johnson, we do believe that mental health is one of the pressing issues that we have worldwide, and that is not really tackled enough. It's estimated that about 1 billion people around the world suffer from mental health issues. So we're here today to talk about mental health and how can we tackle this issue here specifically in the UAE.
Thank you for this opportunity. There's a huge surge lately in mental health challenges across the globe, and which is causing not just mental health impact, but also socio-economic impact across the world. And the way we can address it is not just by, providing care, providing treatment, but also by addressing the social aspect of it, the literacy around mental health, the challenges that come with lack of literacy or the stigma that we have in the community, and also to spread that information that mental health is like any other health condition. Illness could be tackled by compassion, by, destigmatized, access to easy care, and access to early care. So we start from prevention and awareness and screening for early intervention to access to very high quality care, standardized evidence-based care. We are heavily invested in training and education and research, and all the way to the journey of rehabilitation and reintegration. So we really believe and are invested at SAKINA to see through our patient's journey for functional recovery.
In a way, it's been a silver lining when COVID came, because it almost gave the opportunity for people to say that they are feeling anxious or they're feeling stressed. It made it okay to talk about difficulties. We're trying to change the image of mental health. And when people talk about physical health, it conjures up a certain picture. When people talk about mental health, they tend to think of mental illness. And what we're trying to promote is a vision of what mental health looks like as a preventative measure before we get to the point of mental illness. Now, we know, and there's lots of research that talks, that mentions that almost 15 to 20%, so this is 1 in 5 of young people will have some sort of mental health difficulty before the age of 40. A significant amount, almost 50% of mental health difficulties start before the age of 24. So Sakina for children and the ethos of what we're trying to do is going in early, with early detection, early intervention to try and nip things in the bud before they develop into full-blown mental health difficulties in adulthood.
So what the work that Sakina will be doing will be fundamental, really, to ensure that we address the mental health, not as a disease, an illness, right? But rather something that can be tackled and we can improve in the years to come.
So there's a lot of campaigns and a lot of workshops that we are currently being carried out to start at that level of raising the awareness and educating people about what they can do to look after their emotional well-being and emotional health.
So basically what we're trying to do is we are integrating ourselves side by side, shoulder to shoulder with all the other disciplines, be it in tertiary hospitals, at the gatekeepers level in primary care centers, or in secondary care hubs, which are called Sakina hubs. People accepting care for mental health, people seeking out mental health treatment is becoming more and more, better than it used to be in the past. Of course, like Dr. Khaled said, COVID had much to do with it, but also this effort by Sakina to be integrated and collaborative has really caused that shift in paradigm.
We're talking about adolescents, teenagers, but also adults. And I was looking at some statistics also saying that apparently 15% of the adult workforce is suffering from some sort of mental health issues, which if we translate into the population of UAE, we can even say that nearly 1 million people are suffering from mental health issues.
During this month, the October, as you rightly mentioned, the World Mental Health Day, the theme was mental health at workplace. So we've done a lot of robust campaigning across different corporate sectors, different workplaces to promote that healthy mental well-being space for individuals and employees and educated employers on what they can contribute towards a healthy space for their employees. We want to make sure that we are proactive in terms of encouraging a safe space, healthy communication. If an employee is feeling that there are challenges in order to deliver because of mental health issues, then they should have that opportunity to speak up and say that I'm not able to cope.
Often any difficulties are picked up in schools or they're picked up in family physicians' offices or with pediatricians. So your typical child and adolescent will spend most of his time either at home or at school. So it's through educating schools and educating our colleagues, family physicians, pediatricians, and educating parents. This is where you can intervene early and then address things earlier.
Yes. And at Johnson & Johnson, we also believe that, we can increase the burden, a lot through education, breaking the stigma, making sure that from the very young ages, people understand that, okay, this is not a problem, right? It's something that can be addressed, treatable, right? Making sure that people are aware, making sure that people have access to the right treatments, the right care, and also the right support.
Obviously, the main difference is mental health is sometimes specific to the culture. Having the cultural awareness of having something that is tailored to the particular needs of the culture that we live in. But certainly from a child and adolescent point, there's no escaping technology these days. As a way of learning, it's become part and parcel of day-to-day education. It's become part and parcel of every adolescent's life. Some of the ethos in SAKINA is we would utilize the latest technologies.
The challenges that the mental health realm have evolved. I mean, it's not the traditional depression, anxiety, bipolar anymore. There are so many of those, underlying causes like isolation from all that social media addiction and all people being confined to the social or virtual spaces and losing that connectivity, the connections with human, and also the pressure that they live in, the kind of lifestyle we follow, that roller coaster kind of a lifestyle that we live in today. So how do you take care of yourself first? How your mental well-being, it needs to be a priority before you start caring for an individual with mental health challenges.
In Johnson & Johnson, we do have specific programs to address mental health and well-being in order to ensure that people that are working, but also their families, have the full support. Right? We have specific programs when an employee has a problem on its own or in their families, and we also have programs specifically to ensure that they have a good well-being also, because this will definitely impact their mental health, right?
We are a part of a larger network. So Pure Health, we're a subsidiary of SAHA. SAHA is a subsidiary of Pure Health. And Pure Health has launched a Pura app, which is phenomenal when it comes to healthcare needs. And a huge component of that services provided on that digital platform is mental health. So it's the whole array of services from, access to information on, mental well-being, how to self-screen for yourself and make sure that you are having, the mental health literacy around what the journey looks like for somebody who's in a stressful situation, etc., to access to care.
The screens are not the enemy. It's what they do with the screens that then determines whether it's used for what. So, you and I might spend hours in front of a screen, maybe more than we should, but it's sometimes used productively for work and for research and so on. And we're trying to use that as almost a platform to then allow the children to access screens, but use it in a healthy and sort of therapeutic way. Use of technology, standardizing the tools, using it therapeutically, particularly for children who find that medium a better way of communication than sitting in a one-to-one office with a clinician. So they often use technology. So we have simulated gamified apps.
Johnson & Johnson, we're really committed to ensure that, since the 1960s, when we actually were able to innovate in the field of mental health, we have been committed to ensure that patients get access to the care that they need, that they deserve, but also that we decrease the stigma around mental health. And it's really great to have here in UAE a partner like SAKINA. And I'm really looking forward for the future.
I want people to feel comfortable and feel confident to be able to reach out to anyone in SAKINA and address their emotional well-being and mental well-being just as much as they would their physical health and physical well-being.
I think on behalf of SAKINA, I'd just like to mention here that the privilege of living in Abu Dhabi and belonging to this community is humongous, especially the leadership and the support that we get from our leaders. I think we are destined to do a lot for our community.
Fantastic. The future is brighter. Thank you.
Thank you.
Very much.